My name is Sonia Pánkova and I greet all conference participants. I am a member of a team that is interested in the issue of vaginal laxity. The topic of my presentation is correction of vulvovaginal laxity syndrome with the help of plasma. We can deal with the issue of laxity due to the possibility of using the device Jett plasma for her. This device works with 8 intensities, 3 types of applicators. Device is controlled with a foot switch and it's portable. In this picture you can see 3 types of Jett plasma applicator. Vulvovaginal laxity is weakening of pelvic muscles. The syndrome of weakened vaginal walls occurs in vulvovaginal area. Vulvovaginal laxity is caused particularly by vaginal delivery, excessive physical strain, aging, or due to hormonal changes during or after menopause. It is influenced by insufficient vaginal wetness, burning and itching in vaginal orifice, yeast infections, and inflammations. Consequence of the changes in women's intimate parts is also incontinence and, last but not least, worsening of sexual life due to vaginal dryness and irritation, in decreased tightness, elasticity, and sensitivity. This is closely connected with women's mental issue. After menopause, ovaries stop producing hormone estrogen, and concurrently vaginal mucosa and submucosal structures begin to atrophy due to aging. Therapeutic effects are achieved using direct current that provides membrane depolarization and reversible electroporation and thermal stimulation. Direct current as well as other heat sources start collagen activation. Tissue structures is strengthened. The procedure is painless. It does not require application of local anesthetic. It solves rejuvenation of atrophied vaginal mucosa. It is suitable also in cases when local estrogen vaginal creams cannot be applied, for example with estrogen-dependent tumors. After treatment using this device, patients report significant improvement in intimate area. Spontaneous leakage of urine mitigate or nearly ceases, patient's sexual life improves, and the treatment is generally well tolerated and positively assessed for its comfort and painlessness. In this video, we can see a short video. Here is a treatment animation. First time, we use applicator W30. We put a very thin layer of gel on the applicator. Then we introduced the applicator to vagina, and first we work on the front wall of the vagina. And then on the back wall of the vagina. It's very important to make a very slow movement. This treatment takes about 15 minutes. Vulvar rejuvenation we make with flex applicator. We place a thin layer of gel on the vulva and apply the applicator. We move the applicator very slowly. This treatment takes about 5 minutes. The intensity of setting of the device depends on the patient's feeling. The patient must feel warmth and light tingling. In this video, is the vulvovaginal treatment principle animation. During the treatment, small microcharges occur in the gel between the applicator and the tissue. Microcharges causes local increase of electric intensity. Local increase of electric intensity causes nanopore formation in the cell membrane. Macromolecules and ions can easily get into the cell through these pores. Cells increase its volume, and the vulvovaginal laxity is improved. I would like to introduce you to our work, our study, which we are currently doing. It's a prospective, multi-center controlled and randomized post-marketing surveillance study evaluating the safety and efficiency of the Jett plasma for HER2 for vaginal laxity treatment. From 150 patients will be randomly assigned to either the active treatment or placebo treatment. If the patient agrees to the biopsy, she is undergo active treatment. An entrance examination is performed before the treatment itself. After the initial examination, the treatment takes place, which will be performed 3 times. Between the treatments, there should be a time interval of 10 or 14 days. After last treatment, a checkup will be performed after 1, 3, 6, and 12 months. Our primary endpoint is to evaluate the efficiency of Jett plasma for HER2 treatment of vaginal laxity using the vulvovaginal laxity questionnaire. Secondary endpoints to evaluate side effects and adverse events, patient satisfaction using 5-point scale, urinary incontinence symptoms using another questionnaire, sexual function symptoms, and formation of new collagen fibers by biopsies. At present, we have evaluated 51 patients with a mean age of 47.5 years and 2 births in anamnesis. The average patient satisfaction after treatment is 85 to 88%. Patients rate the treatment as painless and well tolerated. Now a few more words about biopsy. First collection of samples for biopsy took place before the first treatment. The second sample was taken 1 month after the third treatment, which corresponds to the first control. In none of the cases in the samples evaluated so far were signs of physical damage to the mucosa observed. I have here 2 examples. One patient is 47 years old, 2 pregnancies, 2 vaginal births in anamnesis. The pre-treatment epithelial thickness of the patient was 226 micrometers, and after the third treatment the biopsy was taken again and the epithelial thickness increased to 528 micrometers. Thus, there was an almost 100% increase in the epithelial layer. The second one, 45 years old woman, 4 pregnancies, 4 vaginal births in anamnesis. The patient's pre-treatment epithelial thickness was 320 micrometers, and after the third treatment the biopsy was taken again and the epithelial thickness increased to 904 micrometers. Thus, there was an almost 300% increase in the epithelial layer. Thank you very much for your attention.